we would like to ask Professor Honig to give us a special lecture entitled on biological basis of neurodegenerative disease, biomarkers, and telomeres.
Well, thank you so much, Professor Sahi, for that nice introduction. And I'm been very grateful for my stay here. It's been very interesting 2 months, and as it draws to a close, I'm very glad to be able to give you this lecture. I know that most of you are in science, although a few of you are in medicine, or both. And I thought I would try to talk a little bit about neurodegenerative disease from a scientific perspective, and some of the issues with neurodegenerative disease, and some of the scientific work we're doing to try to figure it out better. So in America, we always disclose that if we have any relationship, so I have consulting, I do consulting sometimes for other companies, including Japanese ones, like Asing and Dynapon used to be on there somewhere, up there. But I hope you won't feel it will influence my objectivity. As I went backwards. This is an outline of what I will say today. I'm going to talk to you for a few moments about Columbia. Some of you have already heard me say a little bit about Columbia. Then I'm going to talk about the different diseases that cause mental changes, cause neurodegeneration. And then talk about biomarkers, including scientific work that I've been doing. And in the end, if you're interested, I talk a little bit just about some of the ways we're using this sort of knowledge to come up with new treatments. This is Columbia University main campus, and this is the Neurological Institute where I do some of my work. That's the parking lot sometimes. So at Columbia, this is Manhattan, that's the Hudson River. But at Columbia, I have both scientific and clinical activities. Today, I'm going to be talking pretty much about my scientific activities. And those consist of both translational laboratory research, trying to go and figure out disease by using the molecular biological and biochemical tools we have, as well as, at the end, a little bit on drug trials research, trying to use that knowledge to come up with new drugs. Of course, I also have clinical responsibilities, and Dr. Hashimoto has been kind enough to show me how it compares in Japan to New York. So again, this is New York City, and this is the George Washington Bridge. The Neurological Institute just celebrated 100 years while I was here, so I missed the 100th birthday. But Columbia University is here, and Columbia Medical Center is here, about 4 or 5 kilometers away. And this is just some pictures of Columbia. This is the George Washington Bridge again, and our campus, and Manhattan, the hospital, the Neurological Institute, some of the other medical school building, medical students, blossoms, not as nice as Japan, but we have some. My office is right there, so that's where I sit at my desk there. Though I have a laboratory here, and I see patients there, and big place, just like here. So aging is a problem in all the developed countries, but especially in Japan and America. As people age, they're faced with increasing possibility of degeneration in the skin, in the hair, in the bones, but of course, very importantly, in the brain. If we lose our hair, it isn't so terrible, at least not for me, but harder to lose one's brains. So in America, almost 6 million people have dementia out of a population of over 300 million. In Nihon, there's 2 million people we estimate have dementia, very proportional. Most dementia is Alzheimer's disease. But I'll tell you a little bit about some of these other disorders, like Lewy body and frontotemporal dementia, each of which has its own molecules that are involved. So this is a difficult list, the sort of medical school list we put up. Lists all sorts of causes of dementia, of thinking problems. But we group them into degenerative, where we think it has to do with age, but we can't really figure out any other cause. It's not an infection, it's not a stroke, it's not inflammation, it's not a cancer. So we call these degenerative. And most of the dementias in the elderly are degenerative. They're mostly Alzheimer's disease, Lewy body disease, and frontotemporal dementia. What I'll tell you a little bit about is that they overlap, though. A lot of people have Alzheimer's disease and Lewy body disease. A lot of people have vascular problems like strokes and Alzheimer's disease or Lewy body disease. This just is a graph of the number of people we estimate will have Alzheimer's disease over the next decades in the United States. And you can see that right now about 5 or 6 million, but we think about 15 million by 2050. And this is, again, the Neurological Institute, where I do some of my work. But the reason for this, the reason for the increase, is not because it's an infection or because it's spreading like an epidemic like H1N1 flu. It's because as people get older, they get more dementia. So it's aging that's the epidemic. And in turn, that has led to a big increase in people who don't think so well. And that is a big problem because they can't be so productive and they require more care. It's a problem in Japan, it's a problem in America. Not so much of a problem in Africa because people aren't living as long, so it's, but in the developed countries, it's more of a problem. So this just gives you statistics in Boston, not a particularly bad part of America, and you can see that as people get older, there's a much higher chance of having a dementia problem. Maybe some of them just a bit mild, maybe just can't remember a phone number. Some of them maybe very severe, can't even feed themselves. So very variable. This is just a whole collection of curves just like that. The green dots are 2 studies from Japan, and it shows you that they're within the same range. So in each society that we've looked at it carefully, where there's enough old people, there's an increase in dementia with age. So we want to know why that happens, of course, and try to prevent it, and try to treat it if it develops. Wrong way again. I always forget this mouse. It's an American mouse, though. Not as probably made in Japan. So this is just a Japanese survey. Shows you same curve as people get older, almost 50-50, almost 50% chance of being demented if you live to 85 or 90. We all want to live to 85 or 90, right? So I know the first president of Waseda thought everyone should live to 125. But I'm not sure we have too many people under 25. One of the big things that came up in the past was how much was due to stroke and how much was due to Alzheimer's disease. And at least Japan now, just like America, it's mostly Alzheimer's disease. So if you add Alzheimer's disease plus stroke to Alzheimer's disease, it comes out about 60% plus. But a lot of people with Alzheimer's disease, like this big column, also have a stroke. And some people have just strokes causing dementia, even though it's few. So we are trying to understand the relationship between stroke and Alzheimer's disease. Of course, stroke, we think we can treat by just reducing high blood pressure, so that would be not a particularly molecular problem, more of a physiologic problem. And it shows you that they are within the same